Michelle Gurley, specialized in prenatal, postpartum, and pediatric chiropractic care, along with prenatal and postpartum fitness and rehab. We're going to review how to work on the scar tissue after tearing after a vaginal birth. So the scar tissue that we're going to be talking about is the scarring that can happen on the perineum. So the perineum is the space between the vaginal opening anal opening. And so sometimes it can just be the skin tears, and sometimes it's this whole muscular region as well that can tear a little bit. And there's all different grades. So grade 1 is typically going to be just the skin, and then grade 4 would be where it goes all the way through to the rectum. So it's just going to really vary what you had. On average, most people have a grade 2 where it just goes a little bit into the muscle if they do have tearing of their perineum. So more often than not, if there's tearing, there will be stitching. So we want to make sure that we don't do anything until the stitches are out and until things are really healed. So we don't need to be doing scar tissue before tissue's healed. So scar tissue is essentially going to be disorganized tissue. So the body thinks injury, let's just lay tissues down. So it's not going to be nice and smooth gliding, which can run into an issue when we need regions to stretch. So the perineum is going to stretch with sex. So commonly people will have discomfort with insertion after they've had a vaginal birth where they have tearing. And there's so many variables to this, so I really encourage seeing a pelvic floor PT. If you have more questions or if it seems like there's something that's more serious, pelvic floor PT can really answer a lot of the questions and really help you have a game plan going forward. So big message for this is that you should not have pain with sex, but this is a starting point, and I do love people to explore their own pelvic floor. I'm going to give you another visual here. So this is going to be a 3D model of the pelvic floor. So you'll see that you have the vaginal opening and the anal opening and then all this tissue in between. So if you tore just on the skin or through the muscle, all of this is going to still apply. It's just going to be a matter of where you feel the tissue. So if you can imagine that this is the vaginal opening and this tissue here is the perineum, I want you to insert your thumb into your vaginal opening, and then I want you to what I call pill roll that tissue. So that perineum, the space between the vaginal opening and the anal opening. And I want you to feel and see if you feel any tissue that feels different, if it feels tender, if you feel a nodule. And if you do feel a tender area, a nodule, or tissue that just feels different, I want you to spend some time on it. And every time you go to the bathroom for about 10 to 15 seconds, I want you to do that pill rolling on that region. So essentially we're trying to get rid of that scar tissue so that when you have sex and that tissue needs to expand, you're not breaking the scar tissue each time, which is going to cause that discomfort. You will have naturally just good flowing, easy, smooth moving material or tissues that then just stretch. So I'm going to show you another picture. So this one is going to be allowing me to put my fingers, and it has these openings here. So this is going to be the side that you see. This is going to be the internal side. So what you're going to do is place your thumb in to the vaginal opening and then take your fingers and rub along that perineum there. And again, seeing if you can find a nodule. If you find a nodule, so that's going to be the internal side that I'm working on, my thumb's in there. If you find a spot, just spend some time, like I said, pill rolling. 10 to 15 seconds. You don't need to spend a ton of time in this area. It's going to be more frequency. So I ask people to do it every time they go to the bathroom, is just spend a few moments on that nodule or tissue that's tender that they feel. And then once you do that, if you don't feel any difference in 2 to 4 weeks, then that's definitely a time to consider seeing another provider and having work done beyond your own self-care. So I really encourage you to explore it yourself so you know what's going on with your pelvic floor, and if there's some stuff going on with that perineum, if you have any scar tissue that you're noticing that's residual. I commonly find that patients who do this will decrease pretty significantly and pretty early on the discomfort that they feel with sex when they have insertional pain. Now, if you have pain with thrusting, that is going to be something that's a little bit bigger of an issue and is absolutely a time to see a pelvic floor PT. It is not something that you have to live with. So explore your pelvic floor, work on your perineal region to make sure that you get rid of scar tissue postpartum after your birth, and make sure that sex is no longer painful.